Your community partner, Lehigh Valley Hospital Schuylkill, keeping you informed of what's going on. And remember, you can watch all of our shows on ssptv.com. All our health shows are there. Also in the Comcast area, in the greater Pottsville area, with channel 190, 7 to 11 p.m. And of course in the greater Hazleton area, channel 13 and 513. Joining me today, we have Bill Reppy, who is the president, no stranger to the show. He's the president of LVH here in Schuylkill and also vice president of operations in the Northwest regions. Joining us a little later will be Dr. Mady. So, Bill, it's nice to see you.
Good to see you again, Sam. Thank you for having me.
You know, it's interesting. I say this all the time, and it bears repeating. I can't tell you how many people that my wife, if we're out grocery shopping or whatever, or if I'm someplace, I'll come up and say, thank you for having those doctors on, Sam. Thank you for sharing with us what's going on with the hospital. Because how many people get the opportunity of sitting down with you or, you know, Terry or hopefully the new president of Hazleton to be able to see what's happening, all the innovations that are happening. And my gosh, when you look at what has been accomplished with Lehigh Valley Hospital Network over the last 4 or 5 years, it's amazing, isn't it?
It is. We continue to evolve and grow, add new technology, add a lot more providers. We're just really excited about what we've been able to accomplish, Sam. And same thing actually happens to me. They say it's a shame my face was on the TV, but people stop me and say they saw me on the show with you. And but it's,
I make you look good, don't I?
You do. It's the pancake number 5 or whatever it is that makes it work. So it is. It's great to get the word out because you're right. A lot of times people won't ask those type of questions when they see you in public, and so this is a great forum.
In terms of, we're here in Lehigh Valley Hospital Schuylkill here, and what do you have, offering here for the Schuylkill area?
So some of the newer things, the advancements that we're doing is let's talk about our wound center. So we're fortunate enough to have an advanced wound center here to take care of chronic wounds, diabetics, and cancer patients also often need hyperbaric medicine. Mm-hmm. So we are the only hospital that offers hyperbaric medicine in Schuylkill County. We have 2 chambers here that we can take care of people. And the hyperoxygenation in those chambers really helps the curing rate and helps wounds heal that otherwise may not ever heal, and in fact could get so bad that somebody could lose a foot or lose a leg or something. So we're really happy to have that.
What is it, a unit?
It's called hyperbaric chamber.
What is it like?
And it's actually a tube that you lay in, plexiglass open so you can see through it. There's also a television you can see, watch while you have the dive. It takes about an hour, and we pump in super oxygen, and it really promotes healing. And so we're happy to have that available, and we're also happy to announce that we have a new vascular surgeon joining us, Dr. John Guerrero, who specializes in wound management. And so we're really excited to bring him on board.
Is he coming on full-time?
He's coming on part-time, Sam. He's actually from Berwick.
Yeah, and he has a great reputation.
He does. Yeah. Talented
yes.
individual.
Yeah.
And so he still practices in Berwick, and he also practices in Wilkes-Barre. But we reached out to him, Terry and myself, and just said, John, we'd like to talk to you about helping some of the people in Schuylkill County with your expertise, and we have this advanced wound center with hyperbaric chambers. And he's just a great guy. He said, I'm in, let's figure it out. Yeah. And so he's coming on board, and he's going to help us really take care of our patients. We have a lot of vascular disease in Schuylkill County. Yeah. So we're excited about that. And beyond that, sticking with surgeons, I'm happy to say we're adding 3 new surgeons in the fall.
Where are you getting all these surgeons?
I can't let out my tricks, Sam. So
over the last year or 2, Terry's been saying all these people are coming. So where are you getting all these doctors from?
Well, and we're recognized for this. We're a great place to work.
Yeah.
Lehigh Valley has been recognized as a great place to work. So we've been fortunate to have a great recruiting team to find these doctors. So we have 2 general surgeons joining us, which is tremendous. And we also have an oncological surgeon joining us who specializes in breast cancer and breast surgery. There's no one in Schuylkill County that's certified in breast surgery. And so this doctor trained, Dr. Luke Rodriguez, trained in Roswell Cancer Institute in Buffalo, New York. And if our audience isn't familiar with Roswell, it would be the Fox Chase of New York. It's a premier cancer institute, tremendous research is done there. And so Luke's joining us in the fall as well. He's going to be part-time here and part-time at Cedar Crest. And so his focus here is going to be on breast surgery. And so for those patients that are diagnosed with breast cancer, if they need a surgical resection, we'll have a board-certified surgeon to do that.
You know, I'm sure it's in the plans, but it'd be nice if we could, at one of our shows, bring some of these doctors on.
Absolutely.
You know, so people could get a little bit more experience.
Absolutely.
Because I think that's been the thing that people tell me. It's nice to hear from the doctors and
Yes.
their backgrounds, etc.
And put a name with the face.
Yes, exactly.
Yeah, so no, absolutely, we'll absolutely want to have them on and introduce them to our community. We're very fortunate. You know, one of the surgeons is a little bit more experienced, which is awesome. And then we have a brand new resident joining us. She's just finishing her training, and she'll be joining us, and Luke. So we're really excited about adding those surgeons.
You have the School of Nursing, right?
That's correct.
What's going on there?
Well, you might have heard, Sam, there's a nursing shortage.
No kid.
Really?
My wife's an RN.
Okay.
She gets offers all the time.
I'm sure.
And so I said, honey, look, why don't you take a job, let me retire.
Yeah.
But,
She's not biting?
no, I mean, it's amazing. I mean, she's one of the main people with our company here. But it's amazing, you know, the experience, I mean, and that they have. How are you getting them?
So we've been fortunate in our School of Nursing as well. So we just had our graduation last week. We graduated 30 nurses, and within Lehigh Valley Health Network, we retained 40% of the class, which is not bad. We'd like to retain more, but not all of our students are local, so some moved back home, and you certainly respect that. But we've been challenged by our network to grow our school and to produce more and more nurses for the market. And so I'm happy to say that we were maxed out at about 30 students historically. Our incoming freshman class is 60 students, so we doubled the size of our school. And so we're really excited about having those new nurses, you know, be part of our network, hopefully at the end of it, but certainly serve our communities in the broader picture. So really excited about the work going on in our School of Nursing and the growth that we've been able to accomplish there.
Mm-hmm. The carbon expansion.
Yes, well underway. So we just celebrated our one-year anniversary last Friday, Sam. It is hard to believe. And the reception that we've received in that community was so great.
They love you.
They love us.
They love you.
Well, not me. Chris Beege's the president there, and she's a wonderful woman, and they love her. So it's
a lot of great reviews.
Yes,
the Tamaqua area, the whole area, they love you.
And so we actually started planning our expansion 2 months after we opened our front doors. And so we've added recently breast health services to the campus. We've added cardiac rehab to the campus. We've added pulmonary function testing. We've added a laboratory draw station. And we will, in the fall, probably early October, open our ICU and additional medical surgical beds there. Yeah, we've been blessed. The carbon community has absolutely embraced Lehigh Valley Health Network, and we're thrilled to serve that community.
And the new cancer center in Hazleton? That's going up like
that is so exciting. That should open the middle of August, Sam. $20 million investment in cancer care for this region. Luzerne, Schuylkill County, Carbon County, we rank some of the highest in the incidence of cancer in the entire state. And so with our partnership with Memorial Sloan Kettering and our own Topper Cancer Institute, we knew that we had to do some more services in the Hazleton market. And so we will have a state-of-the-art linear accelerator, same accelerator if you went to Lehigh Valley Cedar Crest. So the cancer treatment's exactly the same. We're almost doubling the size of our infusion space because the demand has been great. And so we're really, really excited about opening that cancer center. And we've seen, you know, you sometimes wish you wouldn't have this growth. We've seen similar growth in cancer care here in Schuylkill County. Our volume went up 25% year over year in patients seeking out Lehigh Valley for our cancer care. And that truly, I think, is a testament to Dr. Suresh Nair, the chair of our Cancer Institute, and his team, and our relationship with Memorial Sloan Kettering, and all the clinical trials that we're able to do through our cancer center at all of our locations.
You know, Bill, it's like good and bad news. The bad news is it's a shame that we have cancer.
Correct.
Okay. It was a death sentence many years ago. Didn't even want you to say the big C. Mm-hmm. But the good news is, and you know, I wish I could never have to be involved with that, but the good news is when you look at what Lehigh Valley Hospital has to offer, and maybe sustain lives,
yes,
you know, I think that's where the reward is, and that's why you guys are doing what you're doing.
Absolutely. You know, as short as 10 years ago, if you were diagnosed with lung cancer, it was pretty much a death sentence. You knew you were going to pass away. Now the 5-year survival rate is about 50%. And so that's, I mean, it's only 50-50 odds, but 50% is better than it was 0% 10 years ago.
Exactly.
And so we've made great strides in our research between radiation, chemotherapy, immunotherapy, T-cell therapy. It's just amazing, the research and the work that we can do and the difference we're making in people with cancer.
And my friends, early detection, especially when it comes to breast cancer, any early detection is so very, very critical. That's why there's yearly exams at your doctor. Wouldn't you agree?
Oh, absolutely. The survival rate of early diagnosed breast cancer is greater than 90%.
That's fantastic.
But each year it is undiagnosed, it goes down pretty significantly.
You know, and the hospital offers a lot of clinics and teaching the women how to check their breast, et cetera, because a couple of friends of mine, my wife's friends, you know, after they did a self-examination, felt a little lump or whatever, and thank God they went. Mm-hmm. Some were in 3rd stage, some were in second, or whatever, I guess the different stages.
Yeah, it's 1 through 5.
Yeah, yes. And they were able to at least get help, you know.
Well, the self-exam is critically important because nobody knows our body better than ourselves.
Absolutely.
And so if you do a self-breast exam every month, you will feel an anomaly. You'll feel it before the doctor may feel it, quite frankly, because the doctor's examining you once a year. Yeah. And so, you know, it's important to do that. And certainly if a woman isn't sure how to do a self-breast exam when they come in for their mammogram, we can re-educate them.
And men also.
Absolutely.
Men also check your breast. I mean,
it's true. About 5% of the cancers are in men. Yeah. And so it's important for men. And, you know, speaking of men, testicular as well.
Exactly.
You know,
exactly.
It's all about self-care. And again, you know your body better than anybody else.
So what else is new and exciting? Other than well, I mean, how much more you can tell me, Bill?
Well, Sam, you know, we continue to evolve and look at new ways of delivering care. You know, going back to the nursing shortage a little bit, it's important for us to continue to evolve and make sure that we're doing the right thing as we see more and more treatments moving to the outpatient arena. Mm-hmm. How do we change the model of delivery of care to make sure that we're meeting the needs of our patients on both the inpatient and the outpatient side?
And that brings up something. My friends, some of you have come up and say, why don't you ask them this, why don't you ask them that? And what I'd like for you to do, if it's okay, is email me your questions that you have about the network. Email them to me, and Sam will put the email up there. I, in turn, will turn them over to Tammy, who sets up our meetings here, or Mike, and they'll address those questions. I can't answer all of them. What about this doctor? What do you know about? I always get, what do you know about this doctor? Sure. My daughter has to, my son has to go, etc. And I'm sure the website has a lot of the information on it.
We do, and we have videos of all of our doctors too on the website, so it's always a great place to be introduced to the doctors. But if you knew all our doctors, I'd be impressed. We have about 1,500.
I know 1,425.
Well, that's great, Sam. Good memory,
hey, not bad. Well, Bill, it's always nice talking with you.
Great chatting with you as well.
As usual, keep up the good work as you guys do. You're always out there. I always say Lehigh Valley Health Network is absolutely second to none. Okay.
Thank you for that.
I mean that sincerely, you know.
Thank you.
Other for guys like you and Terry, but other than
that, there's some flaws in the system.
Only kidding. Coming up next, who are you talking to next? We're going to bring in
Dr. Mackenzie Mady. Yeah. She's our director of our residency program. Our residency program is 1 year old now, and we are now, actually tomorrow, introducing our second class of residents.
Okay.
So Mackenzie's a great clinician, came in to help us build this program, and she's going to have a lot of great information about her residents.
Good. We'll take a break. We'll come back and we'll talk to Mady. Welcome back, my friends. I'm Sam Lasanda, and you're watching your community partner, Lehigh Valley Hospital Schuylkill, giving you information that's very important. Remember, you can watch us on Comcast 190 every day, 7 to 11. And also in the Hazleton system covers down to Sinclair, channel 13 and 513, 24/7. And we're also very happy to be media partners with the Possible Republican. Joining me now, as we said before with Bill Reppy, was Mackenzie Mady. Now, you're the director of the Walter and Irene Barham Schuylkill Rural Family Medicine Residency. Wow.
Program. Yes.
Wow. Try to say that fast. So what are your duties and responsibilities?
So as a program director for the residency, I oversee the program itself, which is a training program to train family medicine physicians to become independent physicians, but we're training them here in Schuylkill County.
So how does that work?
So essentially, once you graduate from medical school, then in order to complete your training as a physician, you complete a residency. So for example, we're training family medicine physicians, your primary care physicians. So the requirements are that you complete a 3-year residency. So again, they're seeing patients, throughout the hospital. They're seeing patients in our outpatient practice here in Pottsville, but they're doing it under the supervision of myself and other attending physicians, overseeing them as they see their own patients independently.
Okay, now we did a show, I think, with some of your students or some of the physicians, right? I think
Yes.
that was done last year or
Yes.
whatever. It's okay. How are they doing?
They're doing phenomenal. So so we had our first class of 4 physicians. They are now currently completing the first year.
Are they staying?
Well, actually, interestingly, and part of the goal of the residency itself is to actually train them here in the area so that we can retain them,
Yes,
in an effort. So 2 of them, which is wonderful news, have already signed on to remain with the healthcare system, Lehigh Valley healthcare system.
And how do you attract these physicians then to come into your training program?
I think it was difficult initially, I think, to attract. We were a new residency program. I mean, this originated out of a HRSA grant, but this developed, during the pandemic. So a lot of it was virtual in terms of just trying to advertise and, whatnot. But I think part of the attraction itself is, the training. So as a rural family physician, we're training physicians and sort of the full spectrum family medicine duties. So, it's strong in emergency room training,
Yes.
inpatient training, outpatient training, labor and delivery, et cetera. So we're really trying to have a robust training here in a rural area to meet the needs of a rural community.
So if I graduate from medical school and then general practitioner, but I want to specialize in something, all right, whatever it may be. So then if I come here, do I then get training in that specific area that I want to specialize in?
So a family medicine physician, we, see and do a lot
Or is it
of-
only strictly family medicine?
This is family medicine,
Okay,
yes.
so it's not
see
into surgery or...
No. There's different residencies for general surgery, pediatrics, internal medicine. So we're family medicine, again, training family medicine physicians.
And that's what you are?
That's what I am,
Okay.
yes.
Before we get to do what you do, so that person comes out as already
They're a doctor, yeah.
okay, and they have to train here for work with you for 3 years.
Yeah, 3 additional years where, again, they're seeing patients every day, day in, day out. But again, they have the supervision of one of us, who have already graduated from residency.
Okay, so you are a practicing physician.
I am, yes,
Okay.
I see
So
patients.
tell me what you do during the day.
I mean, I work at a Schuylkill Medical Plaza, so I see my own continuity patients. So again, as a family medicine physician, you can see a patient, again, a newborn, who was just born here in the hospital 2 days prior, up into our geriatric patients. So, the kind of the old saying, birth to grave, type scenario. So, but again, our residents also see their patients at the Schuylkill Medical Plaza in conjunction with us. And, we're doing office visits for chronic disease management, hypertension, lipid abnormalities, diabetes, for example, obviously sick visits if somebody has, they're concerned about an ear infection. We're doing minor procedures in office like skin biopsies, pap smears, et cetera. So we're really doing the full spectrum. Well child checks, of course, because we're seeing kids as well. So
I admire a lot of doctors, but I really admire family physicians. And I'll tell you why. Back when I was a youngster and we didn't have a lot of specialists. You went to a family physician. And that physician had to be trained in different areas. You never know what you're looking at, okay? But to be able to take that person and find out specifically and then be able to say, okay, we got to get you tests for this, we have to do that, etc. The knowledge that you obtain, and I'm sure that people who are training in that program are picking up that kind of knowledge. I really admire you, really admire you, seriously.
no, I mean, that's appreciated, but I think that's the beauty of family medicine. You really don't know what's going to walk in the door in terms of like the what we call the chief complaint of the patient. But at the same token, I think the beauty of it is that nature of the relationship. So you really get a chance to establish, a long-standing, ongoing relationship with your patients. And again, you really can see the whole family.
The trust factor.
The trust factor, yes.
The trust factor
yes,
is so important.
It's phenomenal.
Yeah,
It's phenomenal.
yeah.
So.
And if you have have good bedside manners, because what are they? They're depending on you. They're coming in.
Yes, yeah.
They're not feeling good or whatever,
No,
and
right.
they're depending on, et cetera. And it's so important to have that reputation.
Yeah.
Taking those trainings, the people that are coming in, learning. When I interviewed some of them last time, I'd like to do it again. It was interesting to say why they wanted to come here, and you just said you love Lehigh Valley Hospital.
Yeah.
Why?
I think the network really looks out for our community, and to me, kind of the welfare and the health of the community is one of the most important things, or something that I'm very passionate about. I mean, I'm from this local community myself, and we have a lot of healthcare needs, as a rural kind of underserved community. So I really appreciate the fact that the network, is truly invested in the community. And you can see it even with the residency, because at the end of the day, the part of the concept of this rural residency is this community integration piece, where they're, not just seeing patients here in Pottsville and elsewhere, but they're out at community events and, throughout the entire year. So they're part of the community as well. So I really love that about the
You are
residency.
100% correct. I was speaking to Rotary, and wherever I go and talk, etc., we talk about healthcare systems. I've said this many times. This is a funded show. Lehigh Valley Hospital Network invests in their community. They invest in shows like this that we're able to bring people like you on, and Bill and Terry and a lot of doctors, to inform and educate the people. See, they go above and beyond propaganda. I'm just, they're just great. They're number one, and you know what? They prove it. And that's so true what you're saying.
I think there's a genuine investment in the community.
And when I talk to some doctors, and why do you come to the health network? I always like to know why.
Yeah.
And they're so proud to be a member of Lehigh Valley Health Network.
Well, that's saying a lot.
What else is new and exciting?
Well, we have our second-year class that just joined us. Actually, they're touring the local area, seeing some of the offices. But so now we'll have a total of 8 residents, with us training here in Schuylkill County. So that's exciting at full capacity. So that means, next year we'll have 12 residents, and then it'll become sort of this, cycle where, after the 3 years, the class will leave, and we'll attract, in theory, 4 more. So we'll always have at full capacity 12 residents with us training.
So who's instrumental in the training program as well?
So as a small rural program, we have core faculty. So we have I'm the program director. We have Dr. Peterson, who's the associate program director, Dr. Medali, and both of them practice in conjunction with me at Schuylkill Medical Plaza here in Pottsville. We also have a new faculty member, Dr. Darren Doran, also a Schuylkill County native, which is exciting to come back to the area, and he's practicing out of our Frackville office. And then lastly, we have a behavioralist, Samantha Reinhardt, who also practices at the Pottsville office, and she's there to help to assist from a mental health standpoint, seeing some of her own patients, but then there to help teach and guide the residents, again, from a behavioralist mental health standpoint as well. So it's been really amazing.
So you have great help.
Oh my gosh, yeah, definitely.
Okay. Well, it's always nice seeing you, Mackenzie.
Nice seeing you as well.
And keep up the good work. And at one point in time, we'll be able to get a chance to talk to some of the residents.
That would be wonderful, yeah.
Okay, just to see how they're doing. Okay, I'd like to talk to some of them that have been here for what we did last
That would
year.
that would be really neat to see their perspective.
So once again, I want to thank you, Mackenzie, for coming on the show. And remember, Lehigh Valley Health Network, always raising the bar. We'll see you next time.